Good morning, Lisa. How can I help you?
Hi, Lisa. This is being recorded for myself as well. Can I ask you what your position is real quick? Because I'm trying to find someone who will be able to understand what I'm talking about.
This is membership services.
Oh, okay. I've been dealing with you guys for 2 months now. I've been asking for the vaccine insert sheets that are about 3 or 4 pages thick or wide, I want to say. And no one has given them to me. You guys have refused them, which is actually a Nuremberg violation.
I literally get asked this every single day. I'm a pharmacist, and people are hesitant to take the vaccine. It is not because they are stupid or uninformed. This is an unopened, sealed box of one of the vaccines. This is the package insert that is supposed to tell you everything you need to know about whatever you're putting into your body. All medications come with this. The difference is they usually come with something written inside of the package insert. This is why people hesitate to take it. It's not that they don't care about people. It's not that they're stupid. We just don't have enough information. It's your choice. I'm not saying whether I've been vaccinated or not. I'm telling you, this is why people hesitate to get the vaccine.
Sealed, perfectly sealed, brand new box of the J&J vaccine. You can see here, I'm going to break this open, and perfectly on top is this perfectly normal package insert. It's a lot of safety and efficacy data. In fact, all of the normal information that we would find in a package insert, like the ingredients, that would all be found right here in this package insert. Must be magic.
Hi, the pharmacist.
That's from the Moderna vaccine.
Okay, Moderna. Is it the same for Pfizer and all of the others?
Each brand is a little different.
Okay, so may I take this with me to look at all of the safety studies, placebo safety studies on this?
Yeah, because the one that we give, because the one that's given to patients doesn't contain that information. So that,
which is actually a Nuremberg violation, the first violation on the Nuremberg Code.
And who was this that refused it?
You people, all of you at Kaiser for 2 months. I've been asking for 2 months, and I have months and months of emails of me asking, and you guys saying no. You send me fact sheets. Fact sheets are not vaccine inserts.
Okay, and do you mind if I ask you a few questions so I can better assist you? I can pull up your information here. Okay, thank you. And what is your medical record number? Your account here, and then if I could just have you verify your name and date of birth, please. Okay, thank you. Yeah, let me go ahead and check. So you said these are inserts for the vaccine that they give you the day when you have the vaccine, and they keep referring to?
No. See, the problem is, this is why I don't think most people understand the law. The Nuremberg Code actually requires you guys to give me the vaccine insert sheet from the lot, not from a fact sheet, because a fact sheet is not medical information. You're just summarizing something. The vaccine insert will tell you every single ingredient inside the vaccine, so you can research it and make sure that it's safe for you and your family, which is what I'm trying to do. Then the vaccine insert will tell you every single side effect that comes with that vaccine. It will also then come with tools and tips and all these different things of what to do in case you get in contact with poison or have a side effect from it. So you contact the VAERS system. Okay, so then from there, I've asked you guys to get me those vaccine inserts. No one has given me the vaccine inserts, which is a violation of Code 1 of the Nuremberg Code. You guys have put a thing on your webpage, which is like a lottery, is actually a violation of the Nuremberg Code as well. You're not allowed to coerce or entice people to get the vaccine in any way so that they can be in part of a lottery or win a prize. I've also sent you guys paperwork from the United States government with information from vaccine inserts I've gotten from other countries because you won't give them to me, with the ingredient SM-102, which is polyethylene glycol, which everyone thinks is going to be antifreeze, which it's not actually antifreeze. It's chloroform, which causes inflammation of the heart, which is strange because that's what all those kids are dying from now. It causes cancer.
Cayman Chemical, which makes the alleged ingredient, and the ingredient list for the Moderna vaccine to find out.
The Moderna vaccine does contain SM-102
and birth defects. What are the two things they're talking about right now? They're talking about inflammation of the heart and the reproductive harm it's doing right now. Those are both things that you guys don't have listed on your sheet. But those are two things that I knew about before your sheet. And I've been asking for months, and no one would give them to me. So I went in and took it upon myself to go in and ask for the vaccine insert sheet. Do you know what I found when I asked for it at the pharmacy? They opened the lot in front of me to show me the vaccine insert sheet was blank. So I've been asking how to get a hold of the correct vaccine insert sheet so I can legally, lawfully make an informed consent decision for myself and for my family. And your company has denied me for over 2 months and refused me and treated me like I was a crazy person. I work for the news media. I own a publication company. I run a publication company for music. I own websites. I do tons and tons of work all around the world and for public television. I'm not looking to threaten or harass or do anything. I've been trying to get this information for my own family, for myself, and you guys are denying me. And I've had enough. And so what I'm going to end up having to do is making a documentary about this, unless I can get what I need, because this is illegal and it's a crime. So I'm going to make a documentary, and then I'm going to press criminal charges against you guys. So I would like to know, what can you guys do to stop this from happening? Because I am asking as kindly as I can now for over 2 months, please get me my vaccine insert sheets, which you are required by Nuremberg Code law.
And I see the issues here, so I apologize. I do see that there's somebody working on that for you right now. There was a complaint that's filed, and it went to the case manager.
It's been over 30 days. The initial time I filed it, the initial complaint was on 4/12.
And you haven't got a response back on that one yet? Okay. Have you, I'm sure you have, but have you spoke to your doctor about getting this? Is it something you can get from your doctor?
I've had one doctor that's been working with me inside of your company try to get me the information, and he can't even get it.
Okay. But that wasn't your primary care doctor?
It's one of my primary care doctors.
Okay. So you said you asked the doctor, and then also you spoke to the pharmacy, and they were not able to give it. They didn't have it either?
Not that they didn't have it. You guys have a blank sheet of paper inside of it. I have it on video.
Okay. I can check to see. Let me see which case manager is working on this so I can find out why they haven't responded back to you on that. Just filed on the 9th. Yeah,
that was me. The thing is, I don't have a phone. This is not my phone. I don't use phones. So I use the messaging service, so that way I have a copy and a record of everything. That's why I'm actually having to do this way. So when I messaged them on the 9th, it wasn't for a new case. I'm messaging them. Every message that they have is in regards to the initial complaint that I had. Everything.
Okay.
And so I'm not getting responses, I'm not getting replies, I'm not getting answers, I'm not getting anything. And this has been since April. It'll be 2 months now, tomorrow.
Mm-hmm. Okay, and you're just being told that that we don't have it then? Is that...
No, you're not even, no one's not even telling me anything. You're ignoring me.
Okay. Well, yeah, let me follow up with the case manager and see who, because I do see all the complaints here. So there should be a case manager that was assigned to your case that should be able to further assist you with the outcome. Let me find out who that is and who's working on that for you. If you want to hold on a moment, I can get the name for you.
Yeah.
Okay. All right. Perfect.
Thank you.
Just 1 moment, please. Okay. Thank you for holding.
Mm-hmm.
Okay. So I do have the senior case manager's phone number here, and this is who's been assigned to your case. If you like that direct number.
Yes, please.
Sure. I have a 909 area code, and the number is 367-7654.
7654. Thank you very much.
And this is David L., and this is one of the senior case managers. So if you want to contact him, he can further assist you with the issues.
Thank you so much. And his name is David. All right. It's okay. No, to be very honest with you, I tried to have this conversation 2 minutes ago, and the lady hung up on me. So I appreciate the fact that you stayed on the phone and you listened and you didn't get mad. And I thank you. Thank you. So have a wonderful day.
You too. Thank you for calling Kaiser Permanente.
Hi, good morning, cardiology department. May I please have the patient's medical record number?
Oh, before we continue, I'm at work. My business records the phone calls like you guys, so I have to let you know. Sorry.
Your first and last name and date of birth? Okay. And I'm sorry, what was the first part you said?
My name?
No, before you verified the information.
Oh, like you guys' phones are recording the phone call? Correct?
Okay.
So no, it says that before I even talk to you, it says that the phone calls are being recorded.
Oh, okay.
So I'm letting you know, because in business does the same thing. That's all. That's all I was trying to say.
Okay. Oh, okay. I'm sorry. How can I help you today?
Yeah, I'm supposed to be there for a heart stress test at some point.
Yes. You were referred for a heart stress test. Were you calling to schedule that appointment?
Yes, ma'am.
Okay. So for this appointment, the COVID-19 test is required to do 3 days before coming in for this appointment.
So I have to explain something to you before you even go into that. I have severe allergic reactions to the chemicals inside the rapid antigen test. Triton X100, I'm allergic to. It causes my eyes to swell. Proclin 300, it's harmful if inhaled, and it's actually caused burns on the inside of my nose. And then there's also sodium azide, which is a chemical in some of the rapid antigen tests. So I can't take them because I will have an allergic reaction that could end me up in the hospital. I can't even take the COVID-19 vaccine for the same reason. Triton X100 actually has some of the same chemicals that are in the vaccine, which is the reason that I had the reaction.
Can you do the saliva test?
Well, we had actually asked you if you would do the saliva. Well, no, I can't, because if it goes into the antigen and then you put it inside my body, I'm going to have an allergic reaction, just like I would if you put a peanut in someone who had a peanut allergy.
No, it's like a spit test. So you spit into the cup.
Oh, I spit into the cup. Yeah, you guys told us that we couldn't do that.
We would have, if she would have asked,
She
but
did
we
ask.
tell the patient we
She
send
did
them
ask.
for the COVID test.
Yeah, she did ask.
So I'm not too sure if she did or she didn't ask, but if you can do that one, we do that one because it is required. If not, they won't do the stress test.
So basically, you guys are holding people hostages. You understand that, right? Because these are not even FDA approved. Do you understand that?
So
Hold
if we
on.
can order that test for you,
Ma'am,
we will.
ma'am,
But it has to
hold
be
on,
done. If not, I
hold
can
on,
schedule the
hold on,
appointment.
hold on. You are forcing me against my will to do something medically. Do you understand that?
No,
Yes,
we're not
no, yes,
forcing
you are. If I need to get medical care, I have to follow a set rule that you have created in order for me to get. And so regardless if I say I can do this or not, you will deny me based on yes or no. That is controlling my medical and health care. That is illegal. Do you know that?
Did you want to go ahead and proceed?
Well, hold on. It's not approved. It's FDA emergency use authorized. You guys ran your PCR tests at 43 cycles when they should have been at 23 cycles, which is why you now use the rapid antigen tests. I'm an investigator as well. I do news work. I do a lot of this stuff. I've had to deal with this with you guys for years. I've actually caught you guys violating the Nuremberg Code. So I'm trying to find out what rights you have. What law says that I have to do that?
I can transfer you to my charge nurse.
Yep.
Okay, give me a moment.
Well and stay healthy, follow these tips. Watch how many calories you take in each day and at each meal. Try to eat 5 servings of vegetables a day and 3 servings of fruit and dairy. Avoid trans fats. Stay away from sugary snacks if you can. Make sure to eat whole grains and lean proteins. And don't forget to drink plenty of water. For more information on how to eat healthy and stay well, visit kp.org/nutrition. The Kaiser Permanente app helps put your health at your fingertips. You can use it for you and your family. It's an easy, convenient way to access your electronic health record. Make routine appointments at Kaiser Permanente facilities. Find nearby Kaiser Permanente medical offices and hospitals. Get most test results from past Kaiser Permanente facility visits. Download our app today and let's thrive together. Okay, sir. Thank you so much for holding. So I went ahead and spoke with our charge nurse, and right now he is with the patient, so he's unable to take the call, but I did explain the situation, and he said that we have to schedule the COVID test. You can choose to decline, but it is Kaiser policy, and they will not do the test unless it's done.
Let me help you with something. This is called tyrannical medical services. You are forcing me to take a test that has no validity. If I bring in the medical documents from the government, including the World Health Organization, that shows your PCR tests are frauds that you ran at the beginning because you ran too many cycles, and then I bring in the rapid antigen and show you all the side effects and the issues that I've had, and then I bring in the documented paperwork that shows that these are not even 100% accurate or close to. So if I get a false positive, it could be a false positive and fake in general, and now I have that on my record. I refuse to allow you Nazis to dictate my medical services to me. I have a heart condition that needs checking, and you are telling me I have an ultimatum of either taking a test for something that is false and doesn't work and I can prove it, and bring in every document. You know, let me explain something to you. For your Kaiser Permanente false coding during COVID-19 in the hospitals, you probably don't even know about it because they have you compartmentalized. Look it up.
Okay, sir, so we don't make these policies. These are policies that are come to us.
Policy is not law.
Okay.
Do you understand that? So you are going to deny me a question. You are denying me medical services over a policy that is not law, correct?
No, I'm not.
That's exactly what you just said.
I'm sorry,
You just said it.
not make these rules.
Ma'am, I don't care if you made the rules or not. They're not legal. This is being recorded. It will go on the news site.
Okay, I'm just going to go ahead and further your information to my manager, and she can go ahead and...
No, they won't call me back because you don't understand, ma'am. Ma'am, please listen. Please listen. This phone call is not a real phone. You will not be able to call me back. You will never be able to call me back. I run ghosts phones. For the services I do for work...
If my manager's available, just give me a moment.
Yeah, that's what I thought.
Okay, so the security lock on your account is even above my supervisor. Did the regional director get a hold of you?
No one's
They
gotten
send
a
you
hold of
contact
me.
information?
No one's gotten a hold of me. I don't even have a phone. The phone I'm calling you from is not my phone. I work in media. I work in the news. They're doing this because I have information that they don't want public. They're doing this as a punishment to me. I know what they're doing right now. I'm trying to get my service. So when he says to you, I should know what that means, he's telling me that he's denying me my medical services because he knows that I have information that he doesn't want public. And as
No,
of,
we're not denying
this
you
phone call's
services.
recorded, right?
You just have to call.
This phone call's recorded, right?
Yes.
Okay, so I also want to make sure I let you know that it's been recorded on my side right now as well.
Okay.
I would like to ask, what is it that this person is trying to do?
I have no idea. Like I said, I just got the pop-up when I entered your account. Your account has been flagged for suspicious activity.
By who again?
And the Southern Cal Regional Security Director, Wally Wold.
And his number is?
I do not have that contact information.
So then how am I supposed to have any of this taken care of?
So you would need to call the facility where you are receiving services.
I can't even go to the facility because when I showed up to give them the information I have, they escorted me out by the police. I can't get service. I can't show up to a building. You guys escort me out of the building when I need to get medical services. I've been asking for over a year for a physical and a cancer screening and blood tests. You've denied me all of it for over a year. This is ridiculous. The fact of the matter is, I asked for publicly available and lawful information. You refused to get me that information. Then the man sends me a threatening letter telling me that I don't have this information when I gave him the links and the websites to all of it. I have the Southern California Kaiser Permanente's Pfizer study. I have everything. I know that your study is still ongoing. So the FDA approval for the Pfizer vaccine is for Comirnaty, which is available in Germany and is not here in the US at this moment. So you're lying. I asked for vaccine inserts. You escorted me out of the building. That is Nuremberg and informed consent violations. Those were all recorded. I can't go anywhere. I can't do anything. You guys for over a year have denied me everything. You've made me fight to the bitter end to get any type of any type of medical service at all. I apologize for cussing.
Yes, sir.
So I need to know who or what I'm supposed to do because this is ridiculous.
Okay. Let me reach out to my supervisor again because I did not realize that you.
If I gave you the link to my website right now, you would be so scared of the lawsuit that's coming your way that you would not even sit here and do this with me. I'm not threatening. I'm not trying to do this. I just wanted service, and you guys have done nothing but deny me, have me escorted from the building, and treated me as if I'm a criminal because I wanted health care.
Yes, sir. So the purpose of you signing into kp.org is to make an appointment?
No, the service is so that way I don't use a phone. I don't have a phone. This is my neighbor's phone. So let me explain very clearly so you understand. I don't handle my medication. My wife works with one of my doctors and they sort out the medication. My wife handles it and gives it to me. Okay? So she speaks with the doctor. I am not allowed to have a phone in the work that I do. I can't have a cell phone. So I have to use the app in order to make appointments. And when I send messages, I don't get any information back. And so I'm left stuck in a state of nothingness and waiting. And it's been over a year. I have all of this documented on my news site. I have done this over and over repeatedly asking for help. Your doctors have actually hurt me. I went in for epididymitis and your doctor denied me service. That I even have a record of. I ended up having to go into get the services taken care of by myself because your doctors denied me. The man who is threatening me right now, put that in the report, I think, because he's referencing a date for something that doesn't even make sense to me. He says that I went to a place in Anaheim. I don't ever remember going to Anaheim. Where I live, Anaheim is very far away. I wouldn't purposely go over there. I always go closer to home. So my confusion and my frustration right now is I can't get the services that I need. I can't get the medications unless I have access to the website. I can't get any of the things that I need to get taken care of, like the blood work, the cancer screenings, all of that stuff, because you guys are refusing me service. And I'm paying you monthly for you guys to deny me services, tell me I'm a criminal, and escort me out of the building. So I need
I do apologize that you're being treated that way, but right now you do not have access to the website.
Yes.
While you're on the phone, would you like me to connect you to make an appointment? The only other option you have is to file a complaint.
A complaint with?
The grievance department.
And they're the ones that have been denying me the services. I'm sorry, my phone battery that they have is dying. So if it cuts off, I apologize. So there's absolutely no way for me to get service then. Can I get a number of who I need to call to make contact with whatever to open this up so I can get my services? Because I am seriously about to go to my lawyer, and you guys are in so much trouble. And not only that, the man lied about me in the paperwork, saying I was being threatening at the building. I wasn't being threatening at all. I was trying to show them the information I had. They escorted me out. So now I've been treated severely like a criminal. I am so offended. And I've actually been pretty upset and mentally kind of messed with because of what you guys have done. So can you please just get me the number? That's all I want.
Yes, sir. Try to see if I can locate it for the security administrator.
It might be cutting off here. It keeps beeping at me. Sorry if it does.
Okay.
you.